today, Ontario's Chief Medical Officer of Health recommended the immediate suspension of all large events and public gatherings of over 250 people. I've had discussion with our provincial colleagues, and I can advise that this does not include the use of public transit. The Chief Medical Officer of Health also recommended the deferral of non-essential travel outside of Canada. In addition to these provincial guidelines, today I am making further recommendations because of our local situation to help protect Toronto residents, workers, and visitors from COVID-19. The measures I am recommending will be effective by 12:01 a.m. on Saturday, March 14th, and in place until April 5th. They include the closure of all licensed childcare centres, the cancellation of March break camps, and enhanced measures for travellers. In particular, anyone who has travelled anywhere outside of Canada should self-isolate and avoid contact with others for a period of 14 days. I am making these recommendations based on the available science and evidence and in consideration of our local circumstances. Specifically, I'm making these recommendations for the following reasons. We know that for COVID-19, children often have little or no signs or symptoms of infection. We have seen an escalation in the number of travel-related cases of COVID-19 here in our city. We need to reduce the risk of undetected spread of COVID-19 in people's households. And most importantly, we need to mitigate the impact of this virus and help protect the health of our residents. I recognize that these recommendations will result in significant adjustments to your regular routines, and they may present challenges for many families and for our broader community. Please know that I am not making these recommendations lightly. On the contrary, they are being made after careful and measured consideration. I'm calling on the public, my colleagues here at the City, and my staff at Toronto Public Health to rise to this challenge, as I believe we can together delay the spread of this virus and work well together as we have done so far to date in this COVID-19 response. As I have committed to you previously, I will continue to keep you updated as new facts and new information are confirmed. In the meantime, I encourage you to stay informed by visiting our website, www.toronto.ca/coronavirus, where you can get the latest information on this evolving situation. With that, I will now turn it over to the City Manager.
So thank you, Dr. Davila. Joining me today, as mentioned, are my Deputy City Managers as well as my Chief Financial Officer. And I know earlier today many of you were up at our Emergency Operations Center, so you had a first-hand opportunity to see all of our senior staff in action. So we thank you for taking the time to come visit. As promised by the Chief, the office is in full swing. It is our job to take situations like this and to action them in the sense of providing reasonable approaches for the kinds of important changes that are being contemplated. So based on recommendations from Toronto's Medical Officer of Health, Dr. Eileen Davila, to help slow the rate of COVID-19 infection in Toronto and protect vulnerable populations, including seniors, people with compromised immune systems, and individuals experiencing homelessness, the City of Toronto is cancelling all programs and closing a number of its facilities as of 12:01 a.m. tomorrow. Impacted programs and facilities are as follows. City-operated March break camps are cancelled. All licensed child care centres, community and recreation centres, greenhouses and conservatories, arenas, pools, fitness centres, and ski hills are closed. Libraries are closed. City operated museums and galleries are closed. Council and committee meetings are suspended for the current meeting cycle. As well, public consultations are suspended. All event permits for city facilities, including civic centers, recreation facilities, and parks, are cancelled. Wedding ceremony permits for civic center wedding chambers will be honored. Reimbursements for cancellations will be processed as soon as possible. The tentative date for services to resume is April 5th, 2020. In terms of what's going to continue, emergency and critical services that will continue on as expected include emergency response by Toronto Police, fire services, and paramedic services are not going to be impacted. TTC service will continue to operate. The mass gathering recommendation announced today by the provincial government does not include mass transit. Toronto Water operations will continue, including with that drinking water, wastewater collection and treatment, as well as stormwater management. Garbage, recycling, and organic collection will also continue. Shelters, respites, and drop-in centers continue to operate with measures already established. Long-term care homes will continue to operate with strict visitor restrictions in place. Road, sidewalk, bikeway operations and maintenance, including snow removal, will continue. City Hall, Metro Hall, and civic centers will remain open. The city is updating its website as I speak to ensure that all of this information is available online to the public and at 311. As you can appreciate, this is a very fluid situation and information is changing rapidly. You'll wonder about our labor negotiations, which obviously are ongoing. Both sides are at the table. I've talked to our leadership. I understand that things seem to be going very well. We'll obviously have updates further towards midnight as the tables continue to try to work for a deal. As pointed out, I think earlier, our goal clearly, and I believe it to be the union's goal as well, is to try and resolve this and get a deal so that this is one matter that we don't have to concern ourselves so much about. As well, I just want to say this about the Toronto Public Service. I've been here a year and a half. I've learned a lot, obviously, in that period of time. And one thing I know for certain, whether it be unionized staff or non-unionized staff, their commitment to this city is really unwavering and unquestionable. I am confident, no matter what is unfolding right now and what is going to continue to unfold in the future, that your civil service will be here to deliver everything that it should be delivering and delivering it well. You have a very committed Toronto Public Service. And so with that, I'll end and we'll open the floor up to questions.
Hi, a question about, Dr. Davila, your recommendation to cancel all licensed childcare centers and all March break camps. Obviously, that's outside of what the ones the city operates. Why not just say you have to close? Is that not within the city's jurisdiction to ask private businesses to shut down?
So thank you for the question. I think what we're trying to do here is balance out and to use the least restrictive means possible. We have found that, given our response to date and given the situation that we have in front of us, that people are complying with the recommendations as they exist because they're concerned about the good of our community. And it is standard public health practice to try to use the least restrictive means possible in seeking to achieve public health objectives.
I know this is rare during this time of year, but if there happens to be something like extreme cold, obviously people use respite centers in the city, and that's a gathering of a large number of people. What are the plans for that?
Well, you're right. There is the possibility that there might be an extreme cold weather alert. I hope that's not the case. That being said, we will have to adopt and manage our plans as best as possible.
Okay, so that's not a yes or no? I mean, you'll deal with it when the time comes?
Well, I think at this stage of the game, what we're trying to do, and I can perhaps call upon my colleagues from Shelter Support and Housing Administration to speak to the specifics of the plans and how that might look on the ground itself.
Thank you, and thank you for the question. Yes, should there be a cold weather alert, we will activate the services that we typically operate during that time, which include a warming centre at Metro Hall. Obviously, we will make sure we have adequate space and adequate staff in order to provide that service, but there are no plans changed to the level of service during extreme cold.
Dr. Davila, the self-isolation for people coming back from outside of Canada, I think we're hearing a slightly different phrasing from what you were saying yesterday at the briefing. I think yesterday it was watch yourself for 14 days and go into stay at home if you develop symptoms. Is that different now? Is it just automatically stay at home for 14 days, self-isolate automatically?
That is correct. And it's consistent with the fact that in this rapidly evolving and extremely fluid situation, we are seeing an escalation of cases that are being brought into our city via travel, and we feel that at this point in time, it is appropriate to do that. We are moving more into what I would characterize as a mitigation approach to our current circumstances.
On the issue of the TTC and how the 250 crowd limit doesn't apply to public transit, I don't understand how it can't apply to public transit. A crowd of 250 is a crowd of 250, and if you're pressed together shoulder to shoulder, that's a more risky crowd for a virus exposure. How can this not apply to the TTC? Is there anything different that can be done, aside from what you talked about yesterday, about wash your hands, stay home if you're sick?
And to self-isolate if you've had recent travel elsewhere. So I think a very valid question. What I can tell you is that I did have consultation, so this is a recommendation that is coming from our provincial counterparts or my provincial counterpart around events and large public gatherings. I did call my provincial colleagues and have some discussion around what was included and what was meant to be included within that recommendation, and I was advised specifically that mass transit was not contemplated in that recommendation, that it's not meant to be included in that recommendation.
Dr. Davila, I'm just wondering, the mayor was out of town, actually out of country the other day. Are you recommending that he self-isolates, and also wondering if how many city staff would actually be affected by this from people who have been on trade trips?
So I can't speak to the number of staff that might be affected by this, and I imagine that there are a number of people in our city that would be impacted by this particular recommendation, which again, I will point out is necessary given that we are seeing an escalation in the number of cases that are presenting with travel overseas.
But are you recommending that the mayor self-isolates?
I'm recommending that all travelers self-isolate for that period of 14 days after returning from, travel outside of Canada.
And sorry, perhaps Chris Murray, would you be able to tell us how many city staff would actually be affected by this?
I can't give you an accurate number, although right now, working with our HR personnel, we are assembling that figure.
Not sure who's ideal for this one, but when we're looking at some of these pieces, all these recreation centers and whatnot, libraries you said as well, correct? Yes.
Correct.
There's a lot of vulnerable people in our city who use those facilities. There's a lot of children who use those facilities. It's just a place to go. It's still winter. Can you talk a bit more about how you mitigate, some people who rely on those services?
I think you point out an incredibly important matter. That is why I think the doctor says that arriving at these decisions are not easy, because it does affect sometimes the most vulnerable. And so in light of that, I mean, the highest goal here is to ensure that the public health and safety is taken as primary. And that's why I think you have the recommendations that the doctor is making. And so notwithstanding the valuable contribution that these facilities make to people's lives, I think what's critically important right now is that we do everything, as the doctor points out, to mitigate the further spread of the virus. And so that's why these measures are being, will there be consequences or impacts? I think you're pointing them out, absolutely. I think there will, but we are relying on people to to make decisions, as the doctors pointed out, to protect themselves and to do everything that we can to not spread a virus.
Question for our medical officer of health. Looking at the numbers that came out today, these 12 new cases, I think, in Toronto, and in Peel and York. I mean, some of them are young. This is not, fitting some classic pattern. We're seeing young, we're seeing old, we're seeing many who traveled, we're seeing one that didn't travel. Can you shed some light? Are we seeing community transmission now, given that one of those cases in Toronto, it seems like they did not leave the country?
So you talked about a classic pattern. I would suggest to you that this is a new virus, one that was discovered and sequenced or identified and sequenced in early January. So I'm not sure that we actually have a classic pattern at this stage of the game. We are still very much in the learning phase because this is a new virus that we are trying to deal with and manage. So with respect to community transmission, my understanding is that the vast majority of our cases are still linked to travel from outside of Canada. And at this stage of the game, I don't have a great deal of evidence that suggests, significant or sustained local transmission. But I do believe that, as we've said before, and given the experience, what we know from other jurisdictions, we should not be surprised to see that.
Was this case one of those, though, just to clarify?
I'm sorry, I can't speak to the details of any individual case, but certainly as we start to understand what's happening with respect to our cases, as I've promised to our public and to you, the members of the media, I will continue to keep you informed as we understand more and more about our cases and understand what's happening in respect of local transmission patterns.
Dr. DeVille, I'm looking at I'm not sure what word you used when you announced this, but in writing in the city's news release, it says that you strongly encourage the 14-day self-isolation. Can you be more clear if that's a direction so that employers and employees who are going to have to be dealing with their bosses if they've traveled recently, about how they should approach that if they do have the latitude to take time off work because of your direction?
So it is a strong recommendation. This is what we're asking our public to do. And of course, that includes employers and businesses. We know that we have a significant issue with respect to COVID-19, and we know that many other jurisdictions have had similar challenges, and that those challenges were met by communities, individuals, families, businesses, organizations, all pulling in the same direction and doing as what they can, what each and every one of us can do in order to mitigate the spread. And for many people, that will mean self-isolating for a period of 14 days after travel away.
And so this means that you're asking employers and employees to do the right thing, but you can't force them to do what you're asking.
I think that what I'm saying is that we are asking people at this time to, abide by the recommendations for their own benefit and for the benefit of our community.
Hi, Dr. Villa. Sorry, and I just want to clarify what you were saying to Lauren. So you're saying no evidence of local transmission. That's correct?
So I do not have evidence of local transmission at this stage of the game, and I'm happy to continue to update you and find, inform you as we get more and more information around our particular situation here in the city.
Thank you. So my question is whether TTC users should avoid transit during peak hours, as Canada's Chief Medical Officer of Health advised.
So I think what I have tried to make clear to our public is that if there is a reason for you to be at risk for being infected with COVID-19, that we're asking you to take appropriate behaviors and appropriate actions in order to limit the risk in our community. I recognize that many people do need to go out and about and commute, and oftentimes that means using public transit. And so we ask people to engage in responsible behavior, to engage in good hand washing and other respiratory etiquette or hygiene practices, and to please stay home when you're sick. That's what will make places like our public transit system safe for people to use, as we want to continue to have our city function as best we can under these, unparalleled circumstances.
This is on behalf of one of my national colleagues. We're seeing this panic buying happening in Toronto and elsewhere, crazy lineups in grocery stores. What do you make of this from a medical perspective? Is this what people should be focusing on right now?
Well, I'm not sure that the medical perspective is the real perspective that's warranted here. It seems to me that what we are seeing, though, is some fear and anxiety caused by a lot of uncertainty. And as I've said many times in the past, you know, I understand this, but I would actively encourage members of our public that to think about what are more productive ways by which to expend their energy and in which to channel some of that energy that's there. Appreciate and completely understand fear and anxiety, new virus, risks associated with that, and some uncertainty. And certainly we've seen the experiences of other jurisdictions. So again, I would encourage people to follow the advice that's been provided, to think about planning for their household, understanding their household needs, understanding the needs of their families, and trying to make sure that they have reasonable plans in place. And I do mean reasonable plans in place so that they can manage their household needs in the event that they become ill or somebody else in their household becomes ill. Thank you.
Thank you very much.